Hello, my name is Ara Keshishian, and I would like to review different weight loss surgical procedures and normal anatomy. We will also review the different outcome of weight loss surgical procedures when it comes to outcomes of resolution of comorbidities such as diabetes, sleep apnea, and the weight loss and maintenance weight loss. Let's start reviewing normal anatomy. In normal anatomy, the food goes down the esophagus and sits in the stomach. And as it sits in the stomach, and we'll use the example of the Big Mac fries on a Coke, as the food sits in the stomach, there is a valve called the pyloric valve, which is closed. That valve stays closed till the chemicals are added from wall of the stomach into the lumen of the stomach. As the chemicals are added, that allows for the food that's sitting in the stomach to be broken down into its components, acid, bicarb, intrinsic factor, and so forth. There's a number of reactions that takes place. And as food is physically and biochemically broken down into proper makeup, the pyloric valve opens up, and that's essentially the gateway from the stomach into the small bowel. As the pyloric valve opens up, the food travels down the entire length of the small bowel, and as it travels down the length of the small bowel, within a very short distance after the pyloric valve, the juices from liver and the pancreas are added, and as these juices are added, they allow for the absorption of the carbohydrate, fat, and the protein. Fat and the protein are going to get absorbed along the length of the small bowel, where the juices with liver and the pancreas have been mixed with the food traveling down. Carbohydrate, however, will get absorbed for the most part wherever the food is exposed to the mucous membrane. And I think this is a good place to sort of step back from this and explain that a little further. Again, this is simplification of the facts, but for the sake of our discussion, when we think about carbohydrate, we're thinking such as sugars, again, oversimplified. If you had a cube of sugar and you put that in your mouth, you will get that absorbed independent of whether you swallow it or not. So the sugars will essentially be broken down, dissolve, and get absorbed. Whereas a piece of protein, a hard-boiled egg or a piece of turkey, will not get absorbed for all practical purposes, because it needs to get mixed with the juices from liver and the pancreas so that it can get dissolved and then get absorbed. So as the food travels down the small stomach into the small bowel, there's a very short segment of the small bowel, very short, that it's before the juices come in, and the only thing that may theoretically get absorbed there is the carbohydrate. As the solvent enters from liver and the pancreas, through the entire length of the small bowel, fat and the protein and carbohydrate get absorbed. To keep this overly simplified, there's very little, if any, absorption of content takes place in the colon.